What is stroke? It is a condition where you get some neurological deficits as a result of brain ischemia. So there is something important that you need to understand before we move on, and that is the vasculature of the brain. Another condition where 70 to 80% of the brain can be damaged, and that is when you bleed into your brain, right? And that is called hemorrhagic stroke. So
The cause of ischemic stroke is embolism. So embolism can originate from different sources. It can be cardiogenic embolism, which the cause of embolism is going to be the arterial embolism, or you can say the non-cardiogenic embolism. So paradoxical embolism is a condition where the emboli is being created somewhere else in the body, and then it ends up in your brain while bypassing the pulmonary capillary network, right? So the next question is, which condition is more dangerous, leading to higher rate of mortality, ischemic stroke or hemorrhagic? Of course, in Olympics, Mr. Nadeem Arshad in javelin throw, I'm pretty much sure that he would be hypertrophied in his heart. Can high fever or hypothermia cause stroke? Alright people, it's time to leave for home, and I will be answering rest of the questions on my way back home. See you.
hello, we have a pending session, if I am not wrong, and it was about stroke. Here is your chance to drop down as maximum questions as you can. Good morning people, here we have our third session, which is on stroke, which is actually a condition where we have a neurological deficit because of brain ischemia, cerebral ischemia. There are so many different vessels present in the brain. Most important common ones are the middle cerebral arteries, the carotid artery, the vertebral artery, and also the anterior and posterior cerebral arteries. So basilar artery, I have to say, is also important. All these arteries are at risk of having ischemia, maybe due to obstruction, and most common cause of obstruction is embolism. Now embolism can be cardiogenic, it could be non-cardiogenic, it can even be a paradoxical embolism, which I will further explain. But yes, embolism is a phenomenon which may occur without taking stress, and if it is blocking one of the major arteries, it can damage. I would further like to drag this question because there is something important that you need to understand before we move on, and that is the vasculature of the brain. I highly recommend that you go and study the vasculature of the brain in detail. At least you should know the major vessels which are supplying blood to the brain, including the carotid artery, the vertebral artery, basilar artery, and also the role of circle of Willis and the arteries which is coming out of those circle of Willis, including the anterior, posterior, and the middle cerebral artery, right? Now, having done this study will allow you to understand that what artery is supplying which portion of the brain and what area of the brain. So whenever that particular area or where that particular artery is blocked, you will understand that which portion and how much portion of the brain is going to be damaged. So for example, carotid arteries supply blood to the middle cerebral artery, anterior cerebral artery, and the major portion of the brain will be. And also one last thing before we move on to the next question, regarding this question is another condition where 70 to 80% of the brain can be damaged, and that is when you bleed into your brain, right? And that is called hemorrhagic stroke. So stroke can be divided into two. One is ischemic stroke, where there is no bleeding, but there is a loss of blood supply to a certain area of the brain. And then there is a hemorrhagic stroke, where the certain arteries burst, and then they cause hemorrhage, they cause bleeding into the brain, and that bleeding is a mess actually, that creates a chaos, and it damages the heart much further as compared to the one in the ischemic brain. So yeah, if that is the case, patient is unlucky, he bled into his brain, that will cause 70% of the.
Alright guys, this was a busy day, and here we are going to continue our Q&A session on stroke. And here's the second question: what is the major cause of stroke? And I think I will be answering it in two parts, because stroke can be divided into two types. One is ischemic stroke, other one is hemorrhagic stroke. So first of all, let's talk about ischemic stroke. So ischemic stroke is because of the obstruction of blood in the vessels, and that can be done by two things. One is thrombosis, which may be due to atherosclerotic plaque developing in larger vessels like MCA or carotid arteries. All right. It can be in the smaller arteries as well, like lenticulostriate arteries even. And then the second cause of ischemic is embolism, which is very important. So I'm going to explain that in the second video. Alright, so the second cause of ischemic stroke is embolism. So embolism can originate from different sources. It can be cardiogenic embolism, which means that the emboli is going to be generated from within the heart. Due to various reasons, maybe atrial fibrillation is one of the major causes, common causes of cardiac embolism. It can be due to valvular diseases. It can be also due to heart failure because of pooling of blood, and certain other cardiac infections like endocarditis. So the other cause of embolism is going to be the arterial embolism, or you can say the non-cardiogenic embolism, which means that in atherosclerotic plaques sometimes they rupture and an emboli is created within the arteries, which can enter into the brain and cause blockage. So non-cardiogenic embolism or arterial embolism is actually originating within the arteries. These arteries could be the carotid artery or the vertebral artery, maybe the MCA as well, but mostly from the carotid arteries. And it is actually the atherosclerotic plaques which get ruptured due to higher blood pressures and maybe direct trauma as well sometimes. So that generates the emboli, and which enters the brain and causes ischemia. But then there is another type which is called paradoxical embolism, and this is interesting because it is the situation when the emboli is being created somewhere else in the body, and if it is in the body, then it will have to go back into the heart first as per the anatomy, and then it will enter into the pulmonary circulation, and then from the pulmonary circulation comes back to the heart and then enters into the brain. This is a very important point to understand, that pulmonary network is in between the rest of the body and the heart and brain, and the emboli has to cross that pulmonary network in order to enter into the left heart, and then from there it can go into the brain. But these emboli, they get stuck in the pulmonary capillary system, which are very small capillaries, right? So it's very highly unlikely that any emboli can pass through the capillaries. And of course, if a certain emboli can cross the capillaries, then it will also not block or any artery in the brain, so it will pass through the brain as well. So there will be no ischemia, there will be no blockage. But then there is a certain special type of embolism, which is called paradoxical embolism, in which the emboli being created in any other part of the body will end up in brain. So paradoxical embolism is a condition where the emboli is being created somewhere else in the body, and then it ends up in your brain while bypassing the pulmonary capillary network, right? And how does that happen? It is because of that hole between the two atria, the right atria and the left atria. You have a small hole at the time of birth, which naturally recovers as you grow up. So it gets closed, but in certain individuals it still remains open, and then there is a shunt in between these two atria. So this is the shortcut, this is the place, this is the loophole in that particular heart, where the emboli will travel from the right atria to the left atria, and then from there it will enter into the left ventricle, enters into the aorta, goes into the brain, and may cause ischemia of the brain. So this is called pulmonary embolism. There are certain other causes. Okay, so it is getting lengthier, so I'm going to shut it down. So this is the last part for this causes of stroke. The last part would be dedicated to hemorrhagic strokes. So hemorrhagic strokes can be because of three conditions. So normally One is called AVM, which is atriovenous malformation. This is a abnormal structuring of the arteries and veins, and which is vulnerable part. And whenever you have high blood pressures, so hypertension is the basic cause for stroke in most of the cases. So whenever you have high blood pressures, it may rupture and it will end up in bleeding into your subarachnoid space. So this is called this is one of the cause. Another cause is aneurysm, which is again the weakened structure in the arteries, and that again can rupture because of high blood pressures. And then third one is the direct. Alright, next question is regarding the transient ischemic stroke, its symptoms and its causes. So first of all, what is transient ischemic stroke? The word transient itself means that it is temporary and it resolves on its own. So it's a kind of a mini stroke which gives you the signs and symptoms of a stroke, but it resolves within 24 hours. So you get all those classical symptoms of a stroke, which we call neurological deficits, which is memorized in the form of this mnemonic I have written here called FAST. F is for facial drooping, so you will have this drooping of the face, or probably on the one side of the face, and then arms weakness, and then S is for slurred speech, so there is a problem in speaking. And then T is actually not a symptom, but it is for time, reminding you that time is of essence and you need to do the treatment as quickly as possible. You have 3 to 4 hours to treat the patient, that's all. So the next question is, which condition is more dangerous, leading to higher rate of mortality, ischemic stroke or hemorrhagic? Of course hemorrhagic stroke, because it creates a lot more mess than the ischemic stroke. Ischemic stroke may be localized, and hemorrhagic stroke due to bleeding causes a lot of damage through the major portion of the brain. According to a study, around the 30 days mortality for ischemic stroke is around 10 to 12%, while for the hemorrhagic stroke it is higher. It is even up to 50% even. If I'm not wrong. So 30 to 50% rate for hemorrhagic stroke and 10 to 12% rate for ischemic stroke. So you should avoid getting a hemorrhagic stroke. I have already explained in detail previous stories about what are the different causes of stroke. But if you are talking about risk factors, then risk factor is most important risk factor is hypertension. So hypertension can exacerbate the risk of developing stroke. Okay. Other risks include obesity, hypercholesterolemia, smoking, diabetes, hyperglycemia. Right. So these are the conditions which can exacerbate the development of stroke or any other disease which leads to thrombosis or embolism, like deep vein thrombosis rarely but can cause. In case of paradoxical embolism, I told you earlier, it can be the cause. And also pulmonary problems can lead to pulmonary embolism, that is also a cause. So look out. Is left ventricular hypertrophy a serious condition? Well, I think you would be surprised to know that our hero who was able to win gold medal for us in Olympics, Mr. Nadeem Arshad, in javelin throw, I'm pretty much sure that he would be hypertrophied in his heart. He would have a hypertrophied heart. Why? Because he's an athlete, and athletes and all the other people who have a higher metabolic demand in body, their heart grows in size, and so in order to become more strong to meet the excessive demands of the body, and this makes it a normal physiology, not a pathology. So having ventricular hypertrophy is not a serious condition until unless you have some underlying causes which are contradicting with this particular problem. So it may end up in diastolic. So the next question is, can high fever or hypothermia cause stroke? What would be the pathway? Well, I don't think so. Fever has no direct relationship with stroke. until unless you have certain underlying conditions which is causing fever. The thing which is causing fever can cause stroke. Mostly the fever is because of infections, and if there is a bacterial infection or even a viral infection which is affecting the arteries or heart, may end up in embolism, which can lead to stroke. Probably endocarditis or pericarditis and some other infectious diseases. Infections end up in dehydration, that can also increase blood pressures, that can also cause stroke. Okay, I just realized that I have already drawn this cerebral vasculature on my wall behind, so you should go and read about this. You should know that what are the arteries which are leading to the brain. So this is going to be your carotid artery, and these two are the vertebral arteries, and these, if have embolism, they may end up in blocking one of the arteries in the brain. So this is really interesting. You should go and study this anatomy. Of course, I cannot explain all of that here in this 1 minute video. Anyways, this next question is stroke concerned with mental retardation? Yes, if you call having slurred speech, having difficulty understanding what the next person is saying to you, unconsciousness, or this is all retardation. Okay, so I really want to talk further about this mental retardation question. Firstly, mental retardation is not a very right word to use, and also it's kind of offensive nowadays, so we use intellectual disability of the patients. And in patients who experience stroke, they definitely have some neurological deficits which sometimes are temporary and sometimes they are permanent, so that may end up in intellectual disability. So this could depend on the area of the brain which has been damaged due to stroke. So because if it is the frontal lobe that has been affected, which is involved in execution and decision making, then of course you're going to have a lacking in those particular areas. Or if you are damaged in the temporal regions of the brain that is linked with your speech and comprehension and language, so this is known as aphasia. So that. Alright people, it's time to leave for home, and I will be answering the rest of the questions on my way back home. See you.
Alright, this is the last question, I guess, which is numbness of the brain, specifically in the head area. What is the reason for this? Numbness is actually not a fact with respect to brain, but yeah, this is something that people do describe it as feeling. And it could be of various reasons. Stroke could be one of them, but more important, more common would be the feelings of having anxiety or migraine, or sometimes maybe whenever you have or had an epileptic attack, may end up in numbness of the brain. So these conditions, or maybe some other serious conditions, may be the cause of numbness in the brain. So we don't have any questions at the moment, but I would really like to end this session by stating some other facts which were not discussed regarding stroke, which I think is really important. So one by one I will be discussing all of them, starting with the treatment of stroke. Alright, so first thing that you need to understand about the treatment is that it should be given as soon as possible, because this is a time dependent mortality case or even morbidity case. So stroke patients, they don't have so much time. Normally they have 3 to 4 hours from the start of their this event. So we need to evaluate that quickly. You remember that acronym FAST, the T stands for time, and time was not actually the symptom, but it is a reminder that we need to be very quick about the treatment. So without wasting any time, the patient should right away be taken to the for the CT scan. And why is that so? Because we need to evaluate whether this stroke is actually ischemic or is it hemorrhagic, because this is really important. I will tell you why it is important. So as soon as you realize that your patient is having a stroke, you should call 911 or 1122 in case of Pakistan. This realization that the patient is having stroke or something else, again you are going to use the FAST method, okay, where you're going to see the facial drooping, you're going to check that there is a arms weakness in one side of on one hand and not the other hand, and also the speech of the patient could be slurred. These are the alarming symptoms of stroke. So you should right away take that patient to the hospital, and hospital team should be ready to take that patient, and they should be ready to take him right directly to the CT scan for the CT scan. Why? Because you need to understand that if that is a hemorrhagic stroke, then the treatment for that would be entirely different as compared to the person who is having ischemic stroke. So if it is ischemic stroke, you can go for pharmacotherapy. Okay, so once you realize your patient has ischemic stroke, you should be giving him the TPA treatment, which is tissue plasminogen activators. The drugs like articlase or reticlase, you can give them at 0.9 milligrams per kg, up to maximum of 90 milligrams per day, and some of it given in bolus, 10% in bolus, and the rest in a steady state infusion. And this will dissolve the clot that has been blocking the vessel. This is really important. Along with that, you are going to give aspirin to prophylactically in order to prevent any future clots, and sometimes more severe anticoagulants in case of cardiogenic embolism, like apixaban, rivaroxaban, and fondaparinux, and things. So one very important regarding the TPA treatment, that it should be given as soon as possible. Like its efficacy has been seen only in the first 4 hours of developing stroke, right? After 4 hours, their efficacy will reduce. So that's the first thing. The second thing is that if it's a hemorrhagic stroke, you will avoid TPA because that will worsen the bleeding situation. Third is, do not lower the blood pressures. If they are high, let them be high for the acute period, and this acute period refers to 7 days of developing the stroke. So you're not going to lower the blood pressures unless they're very high, like around 200 or 180 above, okay? And in that situation, you're going to lower the blood a little bit, but not so much, because that will further cause. What happens if your patient has already come to you and it's been 4 hours since he has arrived at the hospital? So it means that you're not going to administer TPA for him. So of course, for that patient, the option would be surgical. You would go for thrombectomy or certain other procedures similar to that, and that's not our domain, of course. But again, we should have an idea that if it is between 1 to 4 hours, you should give TPA, which is pharmacotherapy, which is very good. And if not, then you can go for thrombectomy. There are certain other procedures as well, like increased intracranial pressure. You will have to put drain in the brain so you can drain the CSF out. And also in the case of hemorrhagic stroke, the surgical therapy would be much more better because you have to drain out the blood. Dear students, thank you very much. This is all for today. I hope you have learned something new. This was a very fruitful session, and I think a very interesting one. This topic actually necessitates the importance of learning anatomy and physiology. So I highly recommend that you improve your skills by improving your basic knowledge of anatomy and physiology along with the pathophysiology. My recommended reads would be Pharmacotherapy, a patient-oriented approach by Joseph T. DiPiro, and Applied Therapeutics by Koda Kimball. You can use other sources, whatever you want. You can use AI nowadays to help you out. but try to ace your skills, try to improve your knowledge, and only this way we can build a healthy community of informed professionals, of pharmacists. Thank you very much. Until next time.